I'm Margaret Floyd Barry, Master Restorative Wellness Practitioner, author, speaker, and Executive Director of Restorative Wellness Solutions. Each week, I interview the world's leading experts in functional health and nutrition to uncover the latest research findings, case studies, and evidence-based clinical applications for reversing chronic disease, including actionable insights and strategies you can implement immediately to elevate your practice, increase your impact, and change the way health is delivered. Well, this episode did not disappoint. I chatted with Dr. Alan Christianson, board-certified naturopathic endocrinologist who focuses on thyroid care, and his research is truly blowing my mind. I just read his book, The Thyroid Reset Diet, which proposes a totally different mechanism from the sort of usual suspects we see in functional health regarding autoimmune thyroid disease. We did a deep dive into a key thyroid-related nutrient, iodine, and his proposal that it's excess amounts of iodine that are the root cause of the vast majority of hypothyroid cases we see. This was a fascinating interview, and we got into the weeds when it comes to thyroid hormones, the role of antibodies, which was another truly mind-blowing moment, all sorts of details on iodine, where it's hiding in our food and supplements. We talked through why thyroid meds work for so few people and how to support them coming off of those meds successfully, no matter how long they've been on them. In fact, he shared that his record is helping someone wean off them who had been on these meds for 45 years. I did not even know that was possible. He has some rather shocking statistics to share and a delightfully simple protocol for reversing Hashimoto's that I am very excited to experiment with. This is a must-listen episode, and I hope you enjoy it. Hello. Welcome, everybody, to tonight's episode of the RWS Clinicians Corner. I am so looking forward to our conversation today. We have the amazing Dr. Alan Christianson with us tonight. He is a board-certified naturopathic endocrinologist focusing on thyroid care. He is a New York Times bestselling author whose recent title is The Thyroid Reset Diet, an excellent book. In fact, I had it. Oh, it's right over there in the corner. Excellent book that you definitely want to put on your list if you have not read it already. And he is the product formulator for the thyroid-specific formulations supplements, which we're going to talk a little bit about tonight. Dr. Christianson has been featured in countless media appearances, including Dr. Oz, The Doctors, and The Today Show. He's the founding president of the Endocrine Association of Naturopathic Physicians. Welcome, Dr. Christianson.
Hey, Margaret. Thanks for having me. Glad to be with you.
I am so excited for this conversation. We were talking before we hit record about, all the things that we want to talk about. I feel like the challenge tonight is going to be keeping it to the hour. What I would love to do is just start off with what it was that really piqued your interest in thyroid specifically. And not to lead the conversation too much, but you share in your book the story of someone handing you a whole bunch of research on a specific nutrient, you going in with one set of expectations and coming out with a very different story. So can you give us a little bit of the backstory of all of this?
Sure. So that one was kind of a ways into the journey. That was probably like a decade into it or so. But a decade before then, in my clinical rotations, I saw a big gulf between different approaches in thyroid care, conventional and natural. Conventional, not much was done for most people, one medication, pretty broad range of normal, end of discussion, pretty much it. But natural, it was sympathetic. It tried to offer multiple options, but it was kind of like the Wild West in that any symptom was given thyroid medication in high doses. And I saw sometimes it helped, but sometimes it was harmful. Some people had side effects. So I realized that there was a lot that was missing from the conventional model, but there had to be some guardrails, there had to be some parameters, there had to be more to it. So it became a real puzzle. And also at the time, thyroid disease was really rapidly starting to increase, pretty much exactly when my practice began. This was the early 90s. And so it was this real thing where a lot of people were struggling and not getting clear answers from either world.
I think we see that a lot even today. It's not just 10 years ago. A lot of people are still really struggling and not being believed and not being, feeling a little bit gaslit, honestly, in some cases, feeling like they're feeling horrible, but labs look normal. We hear this all the time, right?
Yeah.
But there's definitely solutions for these folks. And can you take us to 10 years down the road? Because, we have a lot of practitioners here who do work with autoimmune many of whom, I mean, even if we don't specialize in autoimmunity, it's so prevalent that it crosses pretty much everyone's desk at a certain point. And thyroid in particular, as we know, one of the top, if not the top, the most common autoimmune that we see.
It is.
I'm wanting to just jump right to the point because you've got this whole piece about iodine. And we know iodine and thyroid are a little finicky together, but there's so much confusion around that, really specifically. Some people are very big proponents of iodine.
Sure.
I'm not going to name any names. Maybe that was the doctor that you got the research from. But
Yeah,
can you
he's
tell
passed
us
away
that
since
story?
then. Yeah. So always knowing about just iodine being an essential part of thyroid hormones, iodine deficiency in the past being a big thing. I was always aware of that, but never put a lot of thought into it either way for my first many years. And then I was aware of ways in which iodine had been talked about a lot in natural medicine as being a mucolytic or being an antiseptic or doing these things that might be useful in various ways. And then there was this idea about thyroid disease being almost universally an iodine deficiency, and that the amounts of iodine we needed were way more than the powers that be were letting us on to think. And it was kind of appealing. How cool would that be if this rampant problem was just a simple nutrient deficiency? I was completely primed to accept that. And the person who really launched these ideas passed away, dear man, kind man. I spent a lot of time speaking with him. And he really just mailed me everything that he had written and all of his citations and all of his work. And I poured through it. And, as much as I was receptive to going into it, it was hard because I just saw inconsistencies. And then I also looked at the larger existing literature on iodine and thyroid disease. And very briefly, nutrients, the more nutrients are like a key. They're not like the gas pedal. More is not more. It's like if the nutrient's not there, the car won't work for sure. But once the key's in the car, if there's something wrong, more keys won't fix it. And 10 keys won't make my Jeep into a Ferrari. It's a Jeep.
Right.
That's all it is.
Right. Absolutely. So then let's talk about this. Let's talk about iodine as this mechanism, because, I will tell you straight up front, I do a lot of work with Hashimoto's. That became inadvertently my specialty, not because I was going after it specifically, but because I happened to have very good results with somebody who is sort of a big name in her space, who had Hashimoto's, secondary amenorrhea to that. And we were able to, get her cycle back. We were able to help put her Hashis into remission. She got pregnant. She's now about to give birth to baby number 3. She's been in full remission, able to go off her thyroid meds. And she talked about this widely. So I ended up having a lot of people come and work with me for Hashimoto's. And I'm going to be completely honest. I've had great results. I haven't thought about iodine. I had never actively sought out using it. I knew it was sort of this hot potato nutrient, and I dabbled a little bit in iodine testing. And I really want to talk about that, how we assess that level, those levels in individuals. But I was looking at it, definitely thinking about deficiency. I was looking at it, wondering about halide displacement of iodine and, wondering if we needed to compensate for that. But I really didn't work with it as a nutrient. I just kind of stayed away from it because the whole thing, it was such a controversial topic, and I was getting good results without it, that I didn't feel like I needed to go there. So reading your book was really fascinating for me, because one of the things you note is that a lot of the dietary strategies that we use when we think about autoimmunity globally, as well as thyroid specifically, might not be for the mechanisms that we think. I think of molecular mimicry. I mean, how many of us have sat in lectures and seen the slide where we see the structure of thyroid and the structure of gluten, and there's just 2 little peptides different? I see, we've all sat through that. So thinking about things like molecular mimicry, reducing the body's inflammatory burden, I'm sure these things, of course, still play a part. But one of the things that you identified is that actually a lot of the foods we end up removing in these diets are high in iodine. And it actually might be the iodine piece very specifically that is what is causing the healing response, not all these other pieces. So can you explain this to us?
Sure. So to answer this, and also a meta answer for your attendees.
Yeah.
So when you're trying to answer things and sort things out, mechanisms are important. And mechanisms are psychologically very compelling. We think that things work because of XYZ. But when we get deep into medicine and science, mechanisms are fleeting, and we can make up mechanistic arguments on both sides of anything. You can make up mechanisms for anything. So mechanisms have to be there. They can't be, you can't have no plausible mechanism why something could work. But a plausible mechanism is not enough to mean that it actually works, you know? So a mechanism is one thing. Epidemiology is also relevant. Epidemiology is always given a bad name, and it's nothing's perfect, but it's one more level of data. It's, you know, if someone says, hey, I did this and it helped me out, we listen. Well, epidemiology is just scaling that. You know, it's just looking at that in a wider scale. And then last off, we need interventional data. So when all these things can converge, so you want to see a convergence of all these three lines of evidence. And to go back briefly about mechanisms, so Hashimoto's, first off, this is Hashimoto's, right? So my last name is Christianson. Here in northern Minnesota, that's half the phone book. You know, it's Scandinavian, right? So it's not a coincidence that Hashimoto's was discovered by a Japanese doctor. They've got the highest rates of thyroid disease globally and the highest rates of iodine intake. All kinds of thyroid disease, they have the highest rates of that. We can talk more about that. So mechanistically, iodine is the backbone for thyroid hormones. Thyroid peroxidase and thyroglobulin are the targets of attack in the case of Hashimoto's. Well, thyroglobulin is the protein that stores iodine, and thyroid peroxidase is the enzyme that oxidizes iodine. So quite simply, when the body has an iodine burden within the thyroid that it can't deal with well, those things become subjects of attack. You know, iodine, it's a sanitizer. You know, you can put iodine, bleach, and peroxide into one mental category. They're all sanitizers. They all generate free radicals. That's how they work. So that's a simple mechanism. Epidemiology, you know, 1924, we started a voluntary campaign of fortifying our salt with iodine. That was because a lot of young men who otherwise could have gone off to World War I had goiters and they were ineligible. And that's what really pushed this, especially around areas that were far inland, right? So after fortification in the following decade, the rate of autoimmune thyroid disease in adult women went up 26-fold, not percent, fold.
Wow.
Yesterday, I was in Rochester, Minnesota, where the Mayo Clinic is. And that's where they did this first research. And that's where they found this relationship. And they saw these rates go up back in the 30s. It was a rare disease before then. Denmark did the same thing in the year 2000. They fortified with their salt with iodine. They did it perfectly as far as how much they wanted to get in reasonable amounts. But they had a 18-year, long as they've counted so far, stretch of about 50% annual increases in most versions of thyroid disease. So that's epidemiology. Then last up, we've got clinical trials. So we've got clinical trials saying that if you take someone and give them varying doses of supplemental iodine, they develop proportionate increases in thyroid antibodies and ultimately hypothyroidism. And we also have trials saying that if you reverse all that, you can reverse thyroid disease for many. And we can talk more about that. But yeah, we've got clear mechanisms, we've got strong epidemiology, and we've got interventional data that all converges on this. And one more high-level thing. So nutrients, we think about like an inverse curve to where too little causes a higher rate of a bad thing, too much causes a higher rate of a bad thing. Iodine is unique among nutrients. And that's because the amounts that are used are so small and because the parts of the body that use it are so limited. So iodine has a special device that pulls it in and blocks it out. It does both. There's nothing like that for magnesium, vitamin C, B12, any other nutrient. There's nothing like that within the body. But iodine has this special pump and blocker. Because of that, if you get a little bit too much, you shut off the pump and you block it. So the paradox is that too much causes a lot of the same problems as too little. And then one last wrinkle briefly, all nutrients, there's a deficiency and a toxicity, but there's also a tolerance. And with iodine, we have a lot of genetic variation among people. And all the genes that are mapped out with a risk for thyroid disease, they're all genes that affect iodine metabolism. And they cause someone to have a narrower tolerance for iodine.
So this is about iodine clearance then. Some of us are going to hold on to it longer, am I understanding correctly? And others will actually have the ability to clear it? Or is it just that we are tolerating higher levels and they're not affecting us negatively because of that genetic predisposition?
They're kind of saying the same thing, but the high level thought is that there's different human phenotypes for iodine metabolism. So one phenotype grew up, or I should say evolved and adapted to coastal environments. So a lot of
Right.
their diet came from the ocean and it had a lot of iodine in there. They developed mechanisms that allowed them to do okay with massive amounts every now and then, or even more often. The other main phenotype was more inland adapted. And they
Hmm.
could do well on just a speck every now and then. They kept every bit and saved it, But you
Right.
can't have both superpowers together. So you get one or
Right.
the other. And so now in the modern worlds, our rates of iodine in intake are generally adequate. But in the US, there's about 20 to 40% of the population, based on age, gender, and ethnicity, that's at a range that's not safe for those with these genes, for those with the inland phenotype. So many people are at levels that aren't crazy and aren't toxic per se, but genetically they can't do well with that.
Is that something that you're doing testing for? Are you looking for particular SNPs to identify which of your patient population is at greatest risk for this? Or are you making kind of the assumption that everyone is fine at lower levels, so let's just bring it down for everybody?
It's a funny thing. So yeah, so the lower amount, so the basic range that someone tolerates when they're more inland is about 50 to 200 micrograms.
Hmm.
Now, someone with a more coastal genetic variation, their range is about 50 to 1100 micrograms. And the 1100 is not every day, but they can tolerate that occasionally. So the range overlaps. So someone won't get deficient regardless of their genetics if they're at a reasonable intake. Now, back to the question about testing, I've written a lot about which genes there are, which ones that are relevant. I've written about how you can go into your 23andMe report, find all of them. But I also talk about the shortcomings and the limits. So we know so much about certain genes, but so little about how they express. One of my favorite examples are the genes that correlate with celiac disease. 50 to 60% of people have some of these genes. And like 1% of people actually get celiac. So yeah, if you're prone to thyroid disease, if you've got thyroid disease, if you've got some signs of thyroid problems, or if it's shown up a lot in your family. And that's actually more meaningful
Right.
than digging through the weeds of 23andMe.
Right. Okay. That's helpful. Now, I'm assuming then we're talking about autoimmunity here, but the same would, given the role of iodine, I'm imagining the same principle applies when it's not autoimmune in origin, or
Yeah,
no?
let's expand on that. So
Yeah.
when is it not autoimmune in origin? So they've done some good studies taking people that had um, thyroid structural changes. They did biopsies on them and found Hashimoto's in a certain percent. Because Hashimoto's, it's a change in cells. It's a
Yeah.
histologic diagnosis. Sometimes it shows up on blood tests, but that's not the definitive diagnosis. So in most cases, we assume it's there. But yeah, if you take people that are biopsy proven Hashimoto's and you go back and say, did you have measurable thyroid antibodies? Half of them never do. So yeah, about
Mhm.
half of people with Hashimoto's are called seronegative. They never have measurable thyroid antibodies. So if someone is hypothyroid and there's not some blatant obvious reason, like they were given amiodarone or they were given lithium carbonate at high doses or their thyroid was taken out, if there's
Right.
there are longer lists you'll see as far as things that cause hypothyroidism. Most things are extremely rare or they're no longer relevant. They were more things of historical
Right.
past, like radiation for tonsillitis or stuff like that. So barring an obvious cause, it's almost always assumed that hypothyroidism is autoimmune, even with negative thyroid antibodies.
Even with negative antibodies. Really interesting. Okay. Um, let's talk about where iodine is hiding in our diets, because I know, particularly with this crowd, most folks are not eating and not recommending that their clients consume straight up, iodized salt. That said, sea salt, as you point out in your book, still has significant levels of iodine and it's hiding in other foods. I know for me, it was a major eye opener. I assumed, sea vegetables, seafood, that seems very obvious. But some of
Yeah.
the other culprits was brand new to me. So can you walk through some of these hidden places that actually have that overlap with things like the autoimmune paleo style of eating that
Sure,
could
sure.
be explaining why they work?
Yeah, so over the last couple decades, they've mapped out iodine intake and it's generally gone up in US populations and they've shown iodine sources. And there's some foods to where the amount of iodine in the food hasn't changed much and the amount of food in the diet hasn't changed much. But
Mhm.
there's two categories of food where the amount in the food has gone up and the amount of that food in the diet has gone up, and that's processed grains and dairy products. So
Right.
it's not even like the gluten molecule per se, it's what happens in the processing of flour products in factories. And some products will list iodized dough conditioners, but there have been studies saying that when things are assayed, there are many products that don't list iodized dough conditioners, but still have so much iodine, it got in there somehow. So, and
Right.
that's probably why a lot of popular diets that go gluten-free or dairy-free may offer some degree of benefit. They're cutting out some of the biggest common sources of iodine.
Right. And dairy, why has the iodine content increased in dairy so much?
And interesting, this actually might plummet in the coming years. The farmers don't like it, but there's three reasons. So it's used as a teat sanitizer. So you clean off
Mm,
the cow's teats before you put on the whole milking
right.
apparatus. It's used, fish meal is a common cheap source of protein in cattle feed. And then it's also fortified in cattle feed. Now, the
Interesting.
fortification in cattle feed is close to going by the wayside, and it's used as a teat sanitizer. There's some alternates that are close to being used widely as well. But so far, those are still issues. And it's not a huge difference from commercial dairy to organic dairy.
Interesting. So interesting. You talk as well about the iodine in supplements, all supplements, but when, specifically thyroid, because there's this, we're looking for iodine because it's such an important nutrient for the thyroid. And one of the things I found really disturbing, and it makes me wonder about how much this applies to all nutrients, not just iodine, is how much difference there is in terms of the quantity on the label versus what's actually in the product. Can you speak to that?
For sure. So yeah, just to pull that back, I talked about like 50 to 200 micrograms being a pretty safe range for someone with thyroid disease. Now, when
Hmm.
someone's wishing to improve thyroid function, they're targeting a lower amount, the lower side of that. And almost any diet, even without a lot of iodine-rich foods, it's hard to get below 50 or 80 or so micrograms per day, unless your diet is almost nothing but raw vegetables. We talk about some big sources, but almost nothing has none. So that's what you're
Right.
up against. There's not a very big window of latitude. So anything you add on top of that ends up being too much for those prone to thyroid disease. And yeah, supplements that say, but there's only 50 micrograms, well, that by itself could push you over the edge. But when you assay that product, it probably didn't have 50 micrograms. There was one study I cited that looked at 120 prenatal vitamins, and it measured their assayed iodine content compared to their labeled content. None were even in the ballpark. Many had 3 or 4 times what they were labeled to have.
That's really disturbing. I'm imagining this is probably the case in many different nutrients, that the actual quantity on the label and then what we're actually
It
getting
is, but
is
iodine is
probably,
a special problem child. It's
yeah,
volatile. This is back to its high
yeah.
oxidation process again. So it breaks down. It's not stable. The amounts of it can vary quite a bit, and that's also a problem in food assays. So it's a mercurial thing to analyze well.
Hmm. I was going to save this for the end, but we're on the topic of supplements. So let's talk a little bit about this, because you have a professional line of supplements for the thyroid that is iodine free, but is also really supportive in helping people navigate hypothyroidism without medications, and helping them get off of those medications. Can you speak a little bit about some of the thinking behind this? And then I want to dig into different aspects.
It's really cool. So I wrote the Thyroid Reset Diet. I was able to dedicate almost a year of full-time work reviewing just all the existing medical literature on. I was focusing on foods at the time, but in looking up foods, you find nutraceuticals. They get got up in the
Mhm.
search. And at first, there was kind of like I was getting weeds I didn't want. I'm like, get out of the way, out of the way. And we went, wait a minute, this is actually a really high quality study. That was really useful. And I was amazed how much there was. Every major company had their thyroid support product that all had the same half a dozen ingredients, and it was all based upon animal studies from the 80s. And yeah, there was all this current research from high quality human studies saying that nutrients could be quite useful for lowering antibodies, benefiting hypothyroidism, helping nodules reduce in size, all these things. So I made a really simple line just based on those studies. I just made it from scratch and said, here's our best evidence. Here's the things that were used in the studies. Here's the exact subspecies. Here's the exact amounts. Super simple. So we got to blend thyroid daily for anybody. Good 1-a-day multi, fine for prenatal as well. They've got Hashimoto's, you do antibody support. They're hypothyroid, you do hypothyroid support. They're crazy simple.
So let's talk. Okay, wait. Well, I want to come back to antibodies. I want to ask another question before I get too far off the iodine, because I feel like it's an important piece, because we hear about it so much. Halide displacement of iodine with exposure fluoride, chlorine, like all of these substances, that these halides that can compete, as I understand it, with iodine. Do we need to be thinking differently in those contexts? How do they play into this conversation about iodine? And then I want to come back to the antibody conversation.
Sure. So it's funny. There's a lot of things you'll find talked about, even in this world of mechanisms, that I kind of poo-pooed mechanisms in general, but a lot of things that are stated about mechanisms in various circles are just simply not true. And it's known. I mean, these things are already known and mapped out. So yeah, so what they're talking about, that pump thing I mentioned, that's called the sodium iodide symporter, N for sodium, so NIS for short. And we know a lot about its mechanisms. So it and pendrin are what draw iodine into the thyroid. And halides just don't interact with it. There's just a specific transporter to iodine, not to all halides. That's pretty well known. There's been a lot of data on how these things affect thyroid function in general. And for other reasons, fluoride does have hypothyroid effects in higher doses. The lowest amounts that may be relevant are about like 10 milligrams a day. And there's some parts of the world to where, due to the geology, natural unprocessed water has a lot of fluoride, like really high amounts. And that actually has correlated with greater risks of thyroid disease. There have been many studies on municipal areas that have fluoridated water municipally. The amounts there don't affect the thyroid. There's been a lot of data on fluoride in toothpaste or whatnot. And I'm not championing fluoride, but below 5-10 milligrams, it's in all foods. All foods have varying amounts of it. Kale has it, tea has it, plums have a fair amount of fluoride, so we can't escape it. It's all about dosage. And there's a threshold at which it's not really relevant to your thyroid. Chloride, aka chlorine, been looked at quite a bit. Too much of it orally raises the risk of stomach cancer. Inhaling it hurts the lungs, causes respiratory issues. No thyroid effects, good or bad. Bromine is my favorite. That's the funniest one of all. So that's the most recently recognized essential nutrient. So yeah, bromide is an essential nutrient. Our bodies require it. Now, the fun thing is that it's in so many foods, and the amounts that we need are not all that big. So we don't really see deficiencies pop up, but it's part of how our body creates collagen. We depend upon bromide for collagen synthesis. And they've even done studies giving people supplemental doses of bromide way above the amounts found in the diet, and watch to see if those doses impacted thyroid function. They didn't. They just don't.
So fascinating. So fascinating. So then, how do you test, how does one know how much iodine, let's call it burden, they have, if they have levels that are either too elevated or truly toxic? And then secondly, how do they evaluate and assess how much iodine they're getting in their diet? Because it's, as you said, it's not something that's labeled. I mean, even you just think about, I'll use dairy as an example. If someone is eating dairy, often we take that out with thyroid anyhow. But if they were eating it, they take their thing of cottage cheese, it's not listing iodine content on the back. So, let's start off with the testing question. Are you testing? And if so, how?
So testing is done in different ways. You can test to see if someone will benefit by doing something or not, like like iron, for example. Does someone need to supplement with iron? You can test and answer that question, and maybe they should, maybe they shouldn't. You could get different outcomes. So some of the studies we can talk more about showing that people benefit by being on a lower iodine diet, some of those studies did test in many ways beforehand. And if the amount of iodine in the thyroid, and even more detailed, the immune system's tolerance to varying amounts of iodine per genetics, if all those things were reflected in serum tests or urine tests, then you should have seen that the people who were higher benefited by reducing, and those who weren't did not. But that just wasn't how it showed up. There really wasn't a strong relationship. So testing beforehand is not predictive of who responds to iodine regulation. Now, testing after someone has limited their iodine intake can be helpful for those who are seemingly not to respond. There are people to where they can lower their iodine and it won't help them. That totally happens. They're actually rather rare. But more commonly, if someone has been following these guidelines for a while and not seeing benefit, then they can test. And if a common finding is that they're not at a therapeutic window. So we know a therapeutic window where people are most likely to respond after they've been eliminating their iodine already.
Okay. Really interesting.
And now back to the first part of the question, knowing your intake. So there really aren't issues where iodine is not absorbed or assimilated. So if you know your intake, you pretty well know your status. You pretty well know what's moving through your body. And super easy thing, iodineinventory.com. I made a free online tool, and you can put a lot of details about your diet, your supplements, your typical food categories, and your thyroid medication. Thyroid medication has a lot of iodine. We've got to think about that. So you can put all that together and put in your gender, age, weight. Yep, iodineinventory.com, and you can find
Perfect.
out where you fit on that spectrum.
That's great. That's fantastic. And then, of course, you have created a diet that has, that's what the thyroid reset diet is this low iodine diet with a very conveniently color-coded foods of the greens, which is eat as much as you want within reason. I mean, we are all big believers in diversity. I always say that eat as much as you want, and like, no, don't just eat,
I did my best in the book to say that all the things that you and your people know are real
yeah.
and are important, and everyone should follow all those guidelines about eating healthy, they all matter.
Yeah.
But just for this one thing, for the iodine, these are the categories. So you're totally right. There's a lot of, you could make a crap diet that's low iodine, or you could make a healthy,
Right.
So yeah, there's many facets to a good diet. But for this one, the studies that showed these radical rates of reversal, that's the only thing they changed. So I do argue you want to eat a healthy diet as well for every other part of your body. But yeah, as far as that goes, it's pretty simple.
So interesting. And I'm seeing, for those who are watching live, I am keeping a little eye on the chat. The chat feature is a little different in the software, so it's hard for me to see. But Ananya, you've asked a question that is totally pertinent to what we're talking about right now. And then I will go back in a little bit and go through the questions that you've had. So Ananya is asking, are dairy or grain products richer in iodine? So if in the case that a client isn't ready to remove both, is there a need to prioritize? And actually this to me brings up, because I've read your book and of course, this inside and out, but it's not necessarily that it's all grain, right? It's the hyper processing of the grains.
Exactly. Yeah.
Which a
Whole
grain-free
grain
diet will
products,
necessarily get rid of, but it's the processing part, correct?
right? Whole grains themselves, like, pour some brown rice in a saucepan and cook that up, or flour products you bake at home. They really don't have significant amounts of iodine. It's processed stuff from the store. So that's an easy one. As far as the amounts, it varies per those food types and per the person's intake. You can have your clients take the iodine inventory themselves and see where they are. And for some people, it's really their composite amount that matters, their total intake throughout the course of the day. So if they're on a bunch in supplements, on a lot of thyroid meds, yeah, they might have other things that are more relevant for them, but it's your total amount that matters.
Right. That's so interesting. While we're talking about foods, gluten, that's the biggie. And I can remember having, just gone through so much of the research. I mean, autoimmune and gluten generally you've been thinking about, but with thyroid, are you seeing some people that are actually able to tolerate gluten and keep autoimmune in check?
Sure. So yeah, there's been some good studies on this. One of the more recent ones, and with gluten, we talk about medical literature. There's most literature is on people that have celiac disease. We've got to put that out there. And most people don't have celiac disease. But those that do have a higher rate of getting thyroid disease, and vice versa. So somewhere around 1% of people have celiac. And of those with thyroid disease, somewhere between 3 to 5% has celiac disease. So it's more common. And with the co-occurrence, many researchers wondered, was there a causal link? Does A cause B?
Mm-hmm.
And so to answer that question, a recent study took people that were newly diagnosed with celiac disease. They had it, they just didn't know it. But once they were diagnosed, it then said, okay, who of them already has thyroid disease as well? So who already has both? They were taken out. So this new group of people that was newly found to have celiac disease were then monitored to see who would develop thyroid disease in this next year. It's going to happen to some people randomly and more for them than for others. Furthermore, you can measure via the anti-transglutaminase antibodies to see if they're compliant on their diet or not. And they knew some people would be and some wouldn't be. So the question was, were those with celiac who did not yet have celiac disease and avoided gluten, were they less likely to get thyroid disease than those that didn't follow instructions and still ate gluten? And they weren't. It didn't change their odds of developing thyroid disease even when they had celiac disease. So the consensus is that celiac disease doesn't cause thyroid disease, and gluten didn't cause thyroid disease for the people, but underlying proclivities towards autoimmunity caused both. So yeah, A didn't cause B, but C caused both A and B.
Now, when we're doing all of thinking about the diet and making these changes, focusing on iodine in particular, are you also looking at some of the other pieces, sort of the I would call them the usual suspects in the functional world, gut health, reducing the inflammatory burden, infections, um, toxin exposure, some of these underlying, let's call them systemic drains on the immune system, or things that are engaging that immune system. Are you including that as part of your work with your thyroid patients? Or are you really just focusing on the iodine and finding that change alone, even without addressing gut issues or any of these other pieces, is enough to move the needle?
Well, I mentioned one of the studies that I've talked about. So in the study, they took people that had Hashimoto's, they had hypothyroidism. There's degrees of hypothyroidism. These people all had overt hypothyroidism. Their TSH scores averaged 14. Many had TSH scores in the 50 to 200 range. And they had T4 levels well below normal. And they had been there for about 4 years. It wasn't a fluke, a one-time reading. So this was the population. The single intervention they did was try to get them to get their iodine intake below about 100 micrograms per day. Mm-hmm. They did nothing else. They didn't work on their gut health or manage infections or, talk about radiation exposure or have them sleep better. That's the only thing they did in the study. Within 3 months, 78% of them had perfectly normal thyroid function. They were fully reversed of thyroid disease. 78%. They did nothing else. Now, that's good enough. But of those 22% that didn't get better, a big chunk of them was not compliant. And that's the time where iodine testing helps. You can see if someone is, not compliant or not aware, missing some sources, and a lot of them weren't. Another big chunk of them, they weren't fully reversed, but they were heading that way. They had radically improved. So if we rephrase that to say, of those who were compliant, how many fully reversed disease or radically improved their disease by doing only this one thing? That was 97% of the participants. So my thoughts are, well, this is someone's top concern. I want them to put most of their energy into what's going to matter the most. If they have other health problems, that's totally important. And I'm not going to ever deny someone to do things that are necessary for your health. And this is not everything. But for this one goal, this one thing makes a really big difference.
That's really remarkable. That is truly remarkable. There's a lot of questions in the chat that I want to get to. I want to first ask a little bit about antibodies, because some really interesting research that you've done in terms of, we think, you already mentioned that sometimes you have somebody who does not present with antibodies at all. They're antibody negative, and yet it is Hashimoto's based on ultrasound. And then, there's always this question of how much do the antibodies matter? Are we trying? It feels good clinically to see them to not have them there, to have a client's thyroid function restored, symptoms resolve, and the antibodies go away. It just feels like this nice, aha, we've taken care of business. But one of the things that I've heard you speak to is that antibodies themselves are not, the levels of the antibodies themselves are not necessarily directly correlated to the progression of the disease, but they can be directly correlated to symptoms regardless of progression of disease. Can you help us unpack that?
This is so weird. When you hear something that you already expect to hear, you didn't learn anything, right? So I always love to share things that you wouldn't expect. And this is a big one. So
it is.
Yeah, your thyroid antibodies, the part of your body they're the least relevant to is your thyroid.
Which is who, how, why,
And to get even deeper than that, they've shown that the thyroid antibodies are not even causally linked with thyroid disease. They're associated, but they're not causal. They're not the things doing the damage. They're kind of like smoke with fire. So there's usually smoke with a fire, but you can burn yourself on hot coals and there's no smoke. And you can have a lot of smoke from just some leaves and there's no major fire. So yeah, they're not even causal, but they are causal for osteoporosis, infertility, heart disease, many cancers, hair loss, weight changes, obsessive compulsive disorder, anxiety, fatigue, edema, we could go on. And all those things I just rattled off, those are with perfectly normal thyroid function. Because it's easy to say, sure, they cause problems because the thyroid is off. No, thyroid's not off. These are people that have perfect thyroid function, but they have measurable, significant thyroid antibodies. They have poor health, they have poor disease outcomes, and they have a big range of symptoms. The biggest problem is that both worlds of medicine has gotten way too fixated on these minutial, irrelevant changes of thyroid levels. They have no bearing on health or symptoms, barring extremes. But the autoimmune thing has huge effects on all of it.
This is, I mean, if I was an emoji right now, I'd have the brain exploding emoji trying to just kind of wrap my head around this, because many of the symptoms you just described, of course, we also think of as thyroid symptoms.
And
Fatigue,
how
weight
classic
changes.
is it that someone eventually goes on medication, but they don't feel any better, because they didn't have an empty bucket. Their thyroid levels, your body can get by on a really big range of thyroid levels. Normal people have a lot of variation. And the relationship between thyroid levels and symptoms is mind-bogglingly loose. I've got some hard numbers. I won't go into the depth of that, but there's so little relationship. Well, one quick hard number. So those that have overt hypothyroidism, their thyroid's shutting down by all measures. Their TSH is more than 20, T4 is way below range. What percentage of that population do you think has classic hypothyroid symptoms?
I mean, I would think it would be high, 80%,
Yeah,
90%.
17%.
17%.
7%. So the flip side of that is 83% are walking around feeling fine. And meanwhile, all these well-meaning doctors think, oh, your thyroid's off by a shade. We got to jump in here and put you on medication.
Well, it really does explain why thyroid medication so rarely works. I mean, that is something I think all of us clinically see all the time you get that person where it's like they were put on, the Synthroid and just all of a sudden, rainbows and unicorns, right? Like life was perfect, but that is
come back to them a few months
rare.
later, and when it does work, it almost never lasts. And the other thing people aren't told about is that thyroid medicines raise the cancer risks, like most cancers by a lot, like more than obesity. And people aren't given warnings like that. Almost everyone based upon irrefutable conventional guidelines, over 85% of people on thyroid medications are unnecessarily medicated. And I would argue in the natural medicine world, it's even broader than that. It's even a more rampant problem than that.
And what I also have learned from you is that the antibodies themselves can increase the risk of non-thyroidal cancer. So thyroid antibodies increasing the risk of cancers like uterine cancer, colon cancer, I believe, kidney. I can't remember the list of examples, but it was distinctly not thyroid cancer.
It is also thyroid cancer, but outside the thyroid, there's other ones too.
Okay. So then this brings me back to the line of supplements that you're talking about. And you mentioned a basic thyroid multi, but also for one with elevated antibodies, we really do want to be bringing those down. And so the supports the nutraceuticals that you brought in, not only iodine free, but proven to be very helpful. And I know that you have unpacked, because we can think of certain things like, desiccated thyroid has been one that has been shown to reduce antibodies. Can you remind me? I can't remember the details. There was a reason why it wasn't as effective and didn't have some of the same benefits as some of the nutrients that you've brought into your product.
Well, it's a whole different thing, right? It's very rich in iodine. So if someone needs thyroid medication, then natural desiccated thyroid is a reasonable option for many people, not all. Pregnancy, elderly, cardiovascular disease, thyroid cancer. There's some reasons why it's not a good fit in many cases, but for many, it's a great fit. I manage many people who are on medication and require them, and it's a reasonable option. But yeah, most people don't need the medication, and when they are on it unnecessarily, it's getting in the way for things for them.
We talked about this before, that the vast majority of the practitioners in our community are nutrition professionals, first and foremost. And some are licensed, but a lot are non-licensed practitioners. So in terms of navigating the medication question, it's out of their scope of practice, of course, to recommend that somebody go off of the medication. That said, a lot of times we have clients come to us where it's really not working, or they want to get off. Explicitly they come saying, I want to get off my medication. And it will absolutely be clear that it's out of our scope of practice to advise them to do so. But our goal is to, of course, get them functioning and to a state of health where they don't need the medication. Can you provide some guidance, because you're the pro at getting people off of their medications and using more natural supports? Any key strategies that these practitioners can be really ensuring that they're using, and then some language for them to use with their clients and or their clients' practitioners, the prescribing physician?
Yeah, super easy question I just saw pop up. What if they've been on meds over 10 years? Currently, my record's 45 years of people on over-medicated and
Wow.
now on no medication doing better than ever. So yeah, there's not really, if someone has a thyroid, so let me back up. So who can possibly come off and how do you go about discussing that when you're not the prescriber? So if someone has a thyroid and they're not currently managing pregnancy, they can pretty much always come off. There's a few
Right.
rare exceptions where the thyroid's there, but it's atrophied to nothing. That's only a tiny percent of those with Hashimoto's, or even a fraction of a percent. So if someone has a thyroid, if there's a thyroid, there's hope. there's a fun tagline. So simple rule. So how do you language that? Well, ask them if their doctor, if to have a conversation with their doctor about deprescribing. There's been a lot of literature on deprescribing in the thyroid world. And without doing anything smart, like your practitioners know how to do with people, without putting them on a good diet or managing their health in any way, about 84% of people can lower their medicine and feel fine. And about half can come off entirely by being
That's
given
amazing.
nothing more than a taper schedule. But when they're working with a good practitioner and eating well and watching their iodine and doing other steps as well, those odds are only better.
It's wonderful.
And in terms of
So,
deprescriber, two quick
yeah.
resources I've trained quite a bit. So there's the Endocrine Association of Naturopathic Physicians, and they've got a simple Endo ANP. They've got a simple tool. You can find a licensed naturopathic endocrinologist. They've all had training on deprescribing. So many doctors have in various ways, not many, but some have, but that's one group that has all had training on that.
Perfect. Wonderful. And then in terms of what these practitioners would be doing, of course, being mindful of diet now, thinking about the iodine content in addition to their other strategies. I'm assuming working with supplements, and we'll talk a little bit more at the end about how they can access and try out your product. Is there anything else that they should be doing? Or is that really, if they're on some good nutraceuticals and they've got the iodine reduced in the diet, and of course, dealing with any of the other overt issues that the client has come to them
I
with,
mean, those two steps
is
will
that
do
enough?
it in almost all cases. It,
Amazing.
it more if you've got a solution that works, you don't need 25 solutions.
It's amazing.
Once we got a way to make electrolytes work, we quit finding out ways to make it work. We called it good.
Right. Amazing. Amazing. Okay, I'm going to go through these questions. I know some of them as we went through, I think we have been okay, I think we have answered a bunch of them, but let me see here. This is an interesting one. And Anya mentions there's different ranges for the antibodies. And you see this from lab to lab. The ranges just seem sort of amazingly different at times. Can you speak to that? And is there an optimal range, or are there certain numbers, above which true alarm?
I wish that all answers were cut and dry, but the reality is our world is full of nuance, and you guys are grown up, so here's some nuance to come at you. Antibodies are heterophilic, which means they don't always do the same things. So a lot of people with positive thyroid antibodies are never going to have them do anything bad at all. And many that have levels that are low normal or up a bit are perfectly healthy. So that happens. And again, there's those with bad autoimmunity that don't even have measurable antibodies. So it flips both ways. As a generalization, when antibodies are in the high 3 digits, or almost always when they're in the 4 digits, like in the thousands and the many hundreds, in almost all cases, they are having harmful effects and correlating with symptoms then. Now, when we get into the mid hundreds, the low hundreds, it's gray. They may be relevant, they may not be. That's a matter of looking at someone's symptoms, their risks, their health. Are there other obvious explanations? You take care of that. Does that help? No. So you triage that and you see if other things affect it. If not, then they can be relevant. And when they're on the lowest side of the scale, they may or may not be relevant at all. But if someone does have overt thyroid problems and no antibodies, you'd want to make sure they talk to their practitioner about getting an ultrasound done.
Yeah.
Number one, that's how you know if they've got autoimmunity. But then number two, thyroid cancer is rampant, and it's more rampant
Right.
amongst those with thyroid autoimmunity.
So good to know here. Next question here is there's actually kind of three parts to this question. Your opinion on armor versus synthetic, cytomel or synthroid, as well as your thoughts on T3. We've talked about a little bit about TSH and the free T4, and we know that that is what's clinically used in terms of diagnostics. T3 being that active form, how does that fit into the picture? I'll leave it at those two questions, and there's a third piece to this, but I'll leave it at those two.
Sure. So the first one, we call these natural versus synthetic. So I don't like that distinction. And I wish we could have started over and not called synthroid, that there's a derogatory label with that. So when we talk about hormone replacement for estrogen, for example, natural versus synthetic means chemically identical versus foreign molecule, xenobiotic, not the same molecule the human body makes. And that's a useful definition. But that's not, we don't use that system for thyroid meds. What we call everything we have for thyroid meds are natural by that definition. They're all chemically identical. I actually like natural thyroid, and many do better on that. But other versions of thyroid, they're not really synthetic by what we call vitamin C in a bottle. It's synthroid is every bit as natural as vitamin C in supplements. They're both synthesized. They're both chemically identical. So it's not bad. And there's many that do fine on it. The biggest question is, does someone need medication? If they do need medication and their body has appropriate amounts of iodine, even if they don't have a thyroid, their iodine intake still matters because it affects how they metabolize their thyroid hormones in their pills. So if they're doing the right things, if they've got the necessary nutrients and they're not being blocked by iodine, most of those people can do well on whatever thyroid medication. And furthermore, there's a blend I made called the T2, T3 converter. And that helps people better use whatever medication they have access to. So T2, T3, reverse T3, you might have heard of those. Would you believe there's about 24 more thyronomines? There's triac, there's tetrol. We could go a long ways. There's lots of different things your body makes thyroid hormones into. And it's got to do that well. It has to regulate that effectively. And that's where being at that good amount of iodine and having the nutrients to support your body, that's where those things come into play. A little more about T3, T4, active, not active. They're all active. So T4 does things T3 can't do, and the body requires that. Reverse T3 does things that no other thyroid hormone can do. And your brain requires that. Your brain can't repair its cells without reverse T3. There's no good guys and bad guys, and there's no need this, don't need that. They're all critical. And not only that, your body is not a bucket with T3 and T4 in there. The amounts in every part of your body are different. Each tissue manages that locally. And even within the cell compartments, they're managed at different ways within the cell. So we can't micromanage this from the outside. We can only get a reasonable amount for the body to start with if it's even needed. In most cases, the body's making some. So it's really a matter of helping the body do its own management better.
That's really helpful to know, because it does start to feel a little maddening trying to micromanage these individual thyroid hormone levels when, one thing's off. And I think the more I practice, the more I realize the body has its own wisdom. And as you say, thinking just about the number of different thyroid hormones at different places, what's showing up in serum isn't going to be reflective of what's happening at different tissue levels in different places in the body.
Briefly, a question I saw for least once was about these optimal narrow ranges. And the truth about that is many people who do need thyroid medications feel better when their TSH is low normal. Totally valid. But there's nothing mandatory about these ideal ranges. Many people can be perfectly healthy and do totally fine with thyroid meds without, outside of those optimal ranges. They're not mandatory, they're optional. So if someone says, hey, I don't feel well in this part of the normal range, I need meds, I feel better in this part of the range, that's okay. That's not bad. But they don't have to be in that part of the range. And the idea that you have to make T3 high normal or T4 high normal, that's pretty misguided. That's based on a lot of assumptions. Healthy people don't have high levels of T3 as a population. Those that do have higher rates of diabetes and breast cancer. So yeah, there's a broad range of normal function for people.
Really interesting. This to me just emphasizes something that we are coming back to again and again in our courses and have to remind ourselves of it, which is that once you start working with these numbers, it can get easy to feel like you're chasing the numbers. And something you're highlighting and underscoring so well here is that we're always taking this in the big clinical picture of what's actually going on with your client. We are not chasing numbers for the purpose of the numbers. We are looking at how the client is actually feeling in their body. How are they functioning? What are their symptoms? If they are fine, then they are fine. We don't need to micromanage. I love it.
Early along in like the mid 90s, I felt like if I could prescribe and I could adjust, I could make this person healthy again, and that was so foolish. What you and your peers are doing is way more powerful than that. If you can help them become more resilient, if you can get them at a better state where their body is not burdened by too much iodine or lacking in selenium or stressed out in some way, those things are way more powerful. You can raise their homeostasis, they can do better again.
The Clinician's Corner podcast is sponsored by Restorative Wellness Solutions, the premier clinical training program for health practitioners who want to learn how to finally get to the root source of their clients' health concerns and help them reverse complex health challenges and chronic illness. You can't afford to keep guessing. Your clients can't afford it either. Today's clients are sicker than ever before. Their health histories are more complex than ever before. And you simply can't deliver the results they crave or build the practice you desire without the right clinical skills. Enter Restorative Wellness Solutions' foundational course, Mastering the Art and Science of Gastrointestinal Healing. Our clinically proven, systematic approach to restoring balance within the body that has helped over 1,000 practitioners transform their clients' lives, grow their business, and change the way health is delivered. In less than 12 weeks, you'll develop the clinical skills and confidence you need to help your clients feel better faster. Learn how to work with advanced lab testing to identify food sensitivities and imbalances within the gut. Craft custom targeted protocols that truly resolve your client's gut issues and work safely and effectively with supplements to deliver consistently life-changing results. Enrollment for our fall 2024 semester is now open. Visit masterguthealing.com to apply today. Teresa has a really good question here. Can you talk about iodine deficiency and cancer? In 2021, I was diagnosed with bilateral DCIS and thyroid cancer, history of breast fibromas, and had replaced iodized salt for sea salt. Now I'm regretting having removed iodized salt because it's not easy to get enough from the diet. So there's a different nuance there. Are there times when we're actually wanting to get more of the iodine?
Yeah. So brief story. With this whole, what was called the Iodine Project, the person who developed it was a gynecologist, and he had seen studies about iodine lowering pain from fibrocystic breast disease. They used massive doses, and it helped about 2/3 of women lower their pain for a few months, but not really longer. And what he thought was that it meant that they were actually iodine deficient, and that this brought them to sufficiency. Now, the problem is that a nutrient can be a drug and work like iodine can stop an infection, right? But that infection wouldn't be an iodine deficiency per se, So a nutrient can be a drug or it can be a nutrient, and he didn't understand that distinction. Now, the breasts have that same pump the thyroid has, that sodium iodide symporter. And there's four main ways that can express itself. There's non-lactating healthy breast tissue. It's pretty much turned off. There's lactating breast tissue. It's turned on a little bit, so there's some more iodine in the breast milk, more than the serum would give otherwise. Then there's fibroadenomatous breast disease. That's an overexpression of the sodium iodide symporter. And when you take a high dose of iodine, you block it. You shut it off for a few months. That's why you lower the pain. Then we have most hormonally sensitive types of breast cancer. They're a more extreme overexpression of the sodium iodide symporter. So a popular story is that Japanese women have less breast cancer because they consume more iodine. Well, the first half is true. Overall, Japanese women have lower rates of breast cancer. But when you get deep and you weed out other factors like less body weight, less alcohol, broader range of green tea, higher intake of phytonutrients, when you take those variables out, and then you take Japanese women and you break them down by their iodine intake is a positive risk factor for breast cancer. And this has shown up now in many other populations. So yeah, iodine intake is a positive risk factor promoting breast cancer. It's not protective.
So interesting. So interesting. We've only got a few more minutes left, so I'm going to do my best to pick out some of the questions that we haven't spoken to at all. Donna asks, could you speak to ingredients like bamboo shoot extract?
I've seen a few studies saying that it may have some effects upon hair growth and hair loss and some types of, what was that? It wasn't alopecia. It was some, I've seen a few obscure, other than that, really nothing that I know good or bad off the top of my head. Nothing useful relative to thyroid function.
Okay, here. How do you explain paradoxical cases presenting with both hypo and hyperthyroid symptoms when people are on levothyroxine?
Wonderful
Could this be
question.
due to variables of iodine levels?
Wonderful question. Yeah. So there's all these images that show like this split half of a woman, and like this half is hyperthyroid and this is hypo, and like here's how these symptoms are different. So the problem is that it's extremely common to have these symptoms mix up. What's happening when you're hyperthyroid is that your body is fighting thyroid hormones. You're resisting that. So many compartments of your body won't be responding to them well. And if you're hypothyroid, many parts of your body are preserving and holding on to thyroid hormones. So it's really common to have those symptoms juxtapose and change. I don't like to even say hypo or hyper symptoms. I'd rather just say thyroid symptoms. The drawback is that if you assume this is a hypo symptom, then you assume the answer is more medication, and that may not be the case. If you've got too much, too little, or if you're unnecessarily medicated, all three of those things can cause pretty much any symptom you can imagine.
Excellent. Are other minerals lacking from our soil that could be making iodine more problematic?
Well, yeah, so there's a small effect that selenium has. It's not none, but I mentioned how that per your genes, you've got a certain range of iodine tolerance. Now, whatever that is, that's genetic, but if you're also deficient in selenium, that'll make that range a little narrower. So many think that selenium solves all iodine problems. We need some, and many can get too little of that. It's totally a good guy here, but it's part of how many deiodinase iodine regulating enzymes work. So yeah, totally true. And all nutrients have some role to play. That's probably the biggest one. But yeah, you can, regardless of selenium, you can still get too much, too little iodine and be problematic.
And with selenium as well. I mean, I know that when selenium levels get too high, that can be problematic as well. So,
Totally.
I mean, with all of these things, it's such a fine balance, and we're wanting to make sure that we're not overdoing it. I really like the way you're like more is not always better. You know, we can get really excited about a thing and then just want it all, and that's not necessarily the way it works. Can you discuss the thyroid and its link with high cholesterol? And I'm going to just add cardiovascular disease with that because I know there's a significant connection there.
Yeah, there's a lot of relationships there. Now, not all people with heart disease have it because of their thyroid, but there's beta receptors for T4 in the liver that correlate with the enzyme HMG-CoA reductase. That's the one that excretes cholesterol from the liver. And most of our cholesterol is what we make. It's more relevant than what we're consuming. So for many years, they've known that if someone is hyperthyroid, they're likely lower in lipids. And if they're hypo, they're generally higher. Not everyone, it doesn't work for everyone that way, but for many it does. And so for a lot of years, they tried to find if there was some way they could make a thyroid hormone that would lower cholesterol but not cause hyperthyroidism. And that was given up on. So yeah, if someone's overtly hypothyroid, they're more likely to have high levels of cholesterol than they would be otherwise. Not absolutely, but more likely. But there's a million reasons why you don't want to be overtly hypothyroid.
Right. 100%. 100%. This last question feeds beautifully into your supplements because I know this is one of the key ingredients that you use. Can you speak to how Nigella seed powder works for thyroid?
Yeah, cool thing. So Nigella, it's been used as a culinary oil, and the seed extract's been studied quite a bit. It's a cool plant, got a lot of nice immune regulating, anti-inflammatory properties, many large studies on it. So it's been shown to lower the antibodies, make weight loss easier, help the body respond better to thyroid hormones, also cut some markers called VEGF, which correlate with later onset of thyroid cancer. So many positive things from high quality human placebo-controlled double-blind studies. Yeah, good evidence on that. And I use that in both nodule control, which helps nodules be less apt to become cancerous and more likely to shrink, and then also in antibody support.
Wonderful. Well, let's talk about how folks can learn more I know you do some great practitioner trainings. If there's, how can they have more of you? I mean, first of all, get Dr. Christianson's book. That's an easy starting point. But also these supplements are fantastic. And we would love to be able to get links to everyone. I know that might be something that we need to do after the fact. But anything else that we can share with them now?
Easy thing. You'll have a link you can share. I got some special materials they'll receive from that. And one of those is a really easy handout for their clients. Like, here's how you start on the thyroid reset diet. And it's a no-brainer, simple thing. It's one page. It's really simple. But yeah, there's tons of practitioner training they'll have access to as well. Like, you saw the deep dive I did on antibodies. So you can get really nerdy on this stuff if you want to. Also, within that practitioner forum, I do brief case consults. It doesn't take long to sort through a case for someone. So I can connect and help with difficult cases and sort things out those ways. So you got a lot of resources from that. And Margaret will have that link for you.
Wonderful. Well, I know that was one of the questions I saw is, does he do consults? So I think you will definitely have takers on this. And I know I personally am very excited to dig in and try these products and start messing around with the iodine content in the diet. This is such an eye-opening conversation. Thank you so much for the work that you're doing and, unpacking these assumptions that we make. I think one of the things that can happen in all health communities, the functional community doesn't escape this, is we lock into a concept. We have there's a proposed mechanism for it, and we just sort of continue assuming that this is this. And it's so important to continue challenging that and to look at all possibilities. And when the data starts to present other explanations, other key pieces, we need to be evolving and adapting and moving along with it. So thank you for being such a key part of this process and for sharing everything that you have learned with us and with the world. It's invaluable.
Well, I'm so excited to be here, and thank you for having me on, because not just to talk to the people directly, but all the lives they're touching as well. This is a massive thing. I honor your work, and you guys are doing the parts that matter the most. I'm very happy to help support you in that.
Thank you so much. Thank you, everybody. We will see you in a couple of weeks. Have a wonderful evening. Thank you for joining me for another episode of the Clinician's Corner. Don't forget to head to the show notes to access additional links and resources. And if you liked today's episode, please be sure to hit the follow button and consider leaving a review, sharing it on social, or texting it to a colleague. The more we spread the word, the more lives we can impact for the better.